QUB-2392 is a novel bioactive peptide. So the QUB was coined from Belfast University, Queen's University Belfast, because we have a collaboration with them. So they were able to extract the compound from skin secretions, from frog skin secretions. And then we needed to identify if it has any anti-cancer effect. So the QUB is Queen University Belfast, and then the 2392 is the molecular weight of the compound. So that terms our compound. We cannot call it a drug now, so it's called bioactive peptide. So this, we wanted to find the anti-cancer activity because previous studies have shown the anti-cancer effect mostly on solid tumors, and we have limited studies on leukemia. So we came together and decided to test the peptide on leukemia cell lines. So we had various leukemia cell lines, 4 of them that comprise of acute myeloid leukemia, acute lymphoblastic leukemia, chronic myeloid leukemia. So we tested the peptide to see the efficacy of this peptide on the leukemia cell lines. And interestingly, we came up with some findings, and then we realized we had pro-apoptotic proteins that were being upregulated, such as apoptosis-inducing factor. And because this is good because one of the problems or the challenges we have with cancer is they escape apoptosis, and apoptosis is a programmed cell death. And if these factors are being upregulated, it's a positive thing. So, and then we also had other tumor suppressors like P53 that was also upregulated, and then we had oncogenes that were being downregulated. And what are oncogenes? These are proteins or genes that ensure the proliferation of cancer cells. So in effect, by mass spectrometry, we did proteomic analysis, and then gene sequencing, we had proteins and genes that were upregulated, and we had genes that were differentially downregulated, and we have the positive genes and proteins that were upregulated that is able to stabilize cancer or leukemia. So in effect, the findings we had with QUB-2392, it has the potential to inhibit the cell proliferation of leukemia cells, and so we have decided, it's suggested that this peptide can further be developed as an anti-leukemic agent. And also we had to explore the mechanism of action, which we employed a lot of molecular techniques that included mass spectrometry, gene profiling. We also did Western blotting, we did qPCR, and then in effect we determined the mechanism of action included apoptosis. So the peptide is able to induce apoptosis, which is good. And then we also find mechanisms such as it has DNA damage, it's able to upregulate some proteins that can affect, downregulate other proteins, other bad proteins when they are upregulated, like ATM and ATR. So those proteins were downregulated. So it has immunomodulatory effect. And then also, we also realized the peptide has anti-proliferative effect as well. So in effect, we're looking forward to having test the peptide on primary leukemia cells, and that is our future plan. And then in the near future, the possibility of this peptide, since it's a novel therapy, it can go into translational medicine, which involve clinical trials, and which in the future can be used as an anti-leukemic agent.